Hello, I'm Dr. David Thomas. I'm a practicing therapist in Tampa, Florida with Whitford Thomas Group. Today we're going to talk a little bit about the physiological causes of drug addiction. I think first when you start talking about the physiology associated with drug addiction, first it's important to remember that anything you ingest in your system, be it alcohol and drugs, is toxic. So because of the toxicity, the more you use the drug and the more the amount of the drug that you ingest, it's going to create a much higher toxicity in the system and therefore much more susceptible to organ involvement. Another kind of physiological response to drug addiction would be diminished short-term memory. And that's probably certainly more common in marijuana use, certainly with alcohol as well. Another physiological cause of drug addiction would be in the area of heart palpitations. With certain types of drugs, you can also get a lot of kind of dermatitises, rashes, things of that sort. Increased heart rate is another result of drug addiction, for certainly physiological. Also, as far as physiological effects, there's probably no organ in your system that doesn't get affected by drug addiction. So whatever organ you're referring to, whether it be the heart, the lungs, pancreas, they all have drugs have a profound effect. Again, more so with prolonged use and the higher the consumption. I'm going to talk to you about the effects of drug addictions in adolescence. First, obviously, with drug addictions, whether it be marijuana, alcohol, any type of amphetamines or any type of pills, certainly with adolescents, it's against the law. So certainly the most important thing is that whatever they're doing, it's against the law. And when we're looking at adolescents, especially in the area of substance abuse or addictions, probably the thing that affects adolescents the most is their motivation. And with motivation, certainly young folks struggle in many areas. And so if you add a drug to those struggles that already exist, certainly the potential for problems not only in school but in dealing with relationships, family, becomes heightened. Another aspect of dealing with addictions with adolescents is it tends to be a disinhibitor. Most adolescents tend to be fairly risk-taking anyway. So if they ingest a drug, be it alcohol, marijuana, or whatever it might be, into their system, their tendency to engage in more high-risk behavior becomes much more heightened. Another aspect of dealing with adolescents as far as its effects on, with addictions, if we just extend the risk-taking out a little bit more, is driving a car, also unprotected sex. There's just really a number of things in dealing with adolescents with addictions. And probably finally, in dealing with addictions, is that most of the research tends to indicate that the brain continues to develop until about age 25. And so if young folks are putting anything in their system that's toxic that could affect the kind of natural maturation of the brain, that's important. Treat drug addicts. When dealing with drug addicts, the first thing you want to begin to do is assess their readiness for change, what we call their stages of change. The stages of change really move from pre-contemplation all the way to action. If in fact they're in the pre-contemplation stage of change, their thinking is that they do not have an alcohol or drug problem and they do not have a desire to change. The next stage of change is what we call the contemplation stage of change. At this stage, the thinking is that I might have a problem, but I still don't have a desire to change. Next stage, preparation. At this stage, the thinking is that, yes, I do have a problem. I want to change. I'm looking for change. I'm just not quite ready yet. And then, of course, the last stage is action. And at this stage, the individual is highly motivated. They believe they have an alcohol or drug problem, and they want to change, and they're actively abstaining. Doesn't mean they're being successful in the process of change yet, but certainly they're highly motivated. Once you've assessed their stage of change, then you kind of gear treatment at that point. Now, the vast majority of individuals who are able to abstain from the use of alcohol and drugs tend to do that on their own, and they do that with the help of friends and family. Others seek out self-help groups such as AA, Smart Recovery, Rational Recovery, and then some seek out treatment. If you know someone who has an alcohol and drug problem, certainly talk to them, spend some time with them, and then maybe you can gear and lead them in